there, I'm Bella. Welcome to our Therapyology Thursday segment. I'm a clinical therapist here at Therapyology, joined by my friend Rachel and our guest Steve. We're here today to talk about substance use, the stigma, why it exists, how to cope with it, and what to do if our loved ones, family, friends, or ourselves are struggling with substance use. How do you feel? Ready to go? Ready to go?
Yeah,
Let's
ready.
do it.
Awesome.
Let's do it.
So our first question for you today, Steve, is how common do you think substance use or misuse really is today?
I think it is very, very common. You know, there is a lot of peer pressure that is going on in terms of young kids and young adults beginning to use at an earlier age, to be able to use substances that are more potent, and also with the increase in mental health challenge, looking for relief. So substance use and substance abuse is really prevalent.
So people using it as a coping tool, is that what you mean?
Definitely.
Okay.
Definitely.
Sure.
You know, I think that there's a lot of pressure that exists on children today and young adults. And that pressure has people feeling uncomfortable. And when you're feeling uncomfortable, the thing you want to do is to feel comfort.
Mm-hmm.
And one of the things that happens, especially early on in use, is there is that feeling that relieves pressure, that relieves it.
Yeah.
And, you know, for me, one of the things that I have come to realize about substance use is that the nectar in the beginning becomes the poison in the end. That it feels really good at the beginning, but over a period of time, it really becomes poisonous.
Yeah, I feel like we ordered that.
And would you say that like initial feeling is what they continue to look for throughout while using substances?
Definitely. And I will be very transparent. I'm somebody in long-term recovery. In fact, next month is going to be 31 years that I'm sober. So I can speak from a place of, you know, personal experience that for myself, there was a sense of relief from using. And there was even a sense of euphoria at times. But I spent most of the time using, chasing that feeling, that it's elusive, that it's really not real. It does take me away from the current moment, but in many cases, it only starts to create more issues.
So what are some signs of these issues? What are the tells that something maybe veering off from normal, healthy use to something kind of concerning or problematic? Yeah,
you know, one of the ways to look at this is, how is somebody physically looking?
Okay.
You know, is their self-care and their own grooming starting to diminish? Is showering becoming a less and less frequent thing? Is caring about the way that they look, is that changing? Somebody who was really into looking a certain way all of a sudden is letting it go.
Okay. So kind of functionality wise.
Yeah, for sure. And then also isolation. This ability to not be seen or heard all of a sudden, staying in the room, excessive amount of gaming or time on the phone.
Withdrawing.
Definitely.
Okay.
And then emotional outbursts is also another way where somebody is not able to emotionally regulate, where you know, mom or dad may ask them to do something, and the no response is seemingly out of nowhere becomes excessive.
Yeah, that makes perfect
sense. So those are a few things, and you guys probably, you know, see it all the time. This feeling of withdrawing from anything that could potentially get in the way of being able to get in the way of addressing substances and not allowing for it to continue.
Okay, that makes sense. Would you say it's like hyper focusing on the substance and letting everything else kind of fall by the wayside? Your responsibilities, your friends, family.
What happens is that the use and that chasing of that sensation becomes the most important thing.
Okay.
And as it becomes the most important things, decisions are made that otherwise wouldn't be made. In fact, it is about being able to keep the ability to continue to use alive. And anything that is a perceived threat is pushed away.
Okay. And how long does it usually take to get to that point? Does it vary individual by individual?
It really does vary.
Okay.
I am of the belief that people have a predisposition,
Okay.
and certain people from the first time that they experience getting drunk from alcohol or THC use or any other drug could be that crossing of the line happens immediately. You just don't
Okay.
know. A lot of it is, you can look into the family genetics and look at other family members, because it definitely runs in the family.
Mhm. So there really is no one size fits all for diagnosing this or seeing how this progresses. And
The one thing that I can say for sure is that once somebody crosses that line into a disorder from abuse, there's no turning back. And we don't know when that line is. We don't know where that place is. In fact, in a fellowship that I have been part of, one of the things they talk about in the literature is that once a cucumber becomes a pickle, it ain't never becoming a cucumber again.
okay.
And I think that that's a really pointed example that we don't know how somebody is going to respond. I know for myself that a lot of people that I used with kind of grew out of it, and they moved on, and maybe they continue to drink socially or use socially, but for me that was never an option, and that wasn't a choice, that wasn't a weakness, that was a fact that existed, that was really difficult to stop.
So how can we prevent these cucumbers from turning into pickles? What
It's
do
a
we
great
do?
question. A great question.
I think there might not be one right answer to that, or
I think
answers.
an answer, right, is to talk about it,
Okay.
and to talk about it early.
That's what we're here to do today.
And absolutely. And I think out of curiosity, like really coming at this from a place of genuine curiosity, and being able to ask your family member, your child, about what's actually going on. Like being able to engage in conversations, the earlier the better. And those conversations, are things that you guys as therapists are really inviting people into all the time. I don't know the best way, but I do know that trying is better than not trying. So
addressing it versus just kind of hoping that it'll magically disappear.
Yeah, curiosity is what are you hoping to get out of this? And where do you see this going?
What do you feel are some of the biggest barriers when it comes to being able to ask those questions and that curiosity?
I fear. Fear.
Fear of what?
I think fear that if I bring up the conversation, that it makes it more real. That they may, if I don't talk about it, maybe it won't happen.
Okay, so if you put words to it, it's a real.
Or that it's
concept.
not as bad, or it's not something that I'm really
I
struggling
think
with.
minimizing, denial is all part of this. And fear is a powerful, powerful emotion. It has many of us frozen in our tracks. So all of a sudden, I'm not going to say anything about it, or I may not say anything because I don't know the right thing to say. And that's to the point of just a minute ago. It's better to say something. And fumbling through this. I think to be able to have a conversation that says, I don't know that I'm going to do this right,
Yes.
but I'm going to do this.
So it's not about the right thing to say, or just saying it. Being able to have that space.
Yeah. Being able to have, if it's from a parent's perspective, have your child really understand how much you love and care about them, not through just words, but through really being with them and being next to them and hearing about what's important. This is a really sensitive subject. So how do we ask questions that get them engaged and talking about this and thinking? Because, that part of the brain that is thinking about what's going to happen in 5 years and 10 years is not developed for most adolescents, right? So really inviting them into thinking about where is this going? Where is the fact that, you got sick yesterday morning after a night out with your friends and you were thrown up? Where do you think this, like, really, where is it going? Because it's so easy to be able to have that that ability to push away what's going to be out in the future to what's happening right now.
So do you think stigma contributes to this fear we have talking about this topic?
For sure.
Okay.
I don't understand stigma very well because, if we really look at substance use disorder, this is a disease like anything else. So if we were talking about cancer or diabetes, the ability to get help right away and get the right help and let other people know that are close to you that this is going on, it happens immediately. And getting the support from people around happens immediately. And that person who's having an issue they may be scared, but they're going to address it rather than run from it. When it comes to substance use disorder, it's completely the opposite. And that opposite is very shaming to the person and the family that's going through it. Nobody wants to feel shame, so it's very easy to isolate. When we're isolating and not talking about it, it is not making it better. And as people from the outside, that misunderstanding about what this really is has created a tremendous divide. You can feel it in many times at doctors' offices or in hospitals, around universities. It exists. And listen, for me, one of the reasons why I do this is to normalize the fact that this is a disease, that you can get better from this disease. And if somebody out there is suffering, man, it is better to take action than to not.
So you're saying it's not a life sentence, struggling through substance use?
Not at all. Recovery and hope is available.
Okay.
Which is huge, and something that I've found people that I meet with, a big thing is really just this overall worry of, okay, I'm going to be affecting everyone else's life too, and that it's their struggle, and so then they'll tend to isolate even more and internalize even more, instead of really creating that space for them to talk about it and utilize supports and again have that sense of safety, because when we're internalizing, our sense of safety is
diminished.
Completely. Exactly.
You bring up a great point, and you guys probably experience this with your clients all the time. Some of the things that we're the most afraid to talk about, when they're actually addressed, on the other side, the comment is, oh my God, I feel lighter, I feel better, I'm so glad that I did that. And it's so true with this, because the weight of not knowing what to do, the weight of the pain of consequences that start coming with a use disorder is huge, especially to handle alone. So stigma and shame it gets healed by opening up.
So it's that initial fear of not saying anything, or the what ifs of if I do say something, and then once we're able to get there and share it, that relief is actually
that's recovery. That's the beginning of recovery, and it's actually the opposite of what I said before, right? So recovery is the poison in the beginning that is the nectar in the end, and the poison in the beginning is the fear and the feeling of addressing this problem, right? So that's scary. So typically in addiction, we want to hide from that and push that away and experience whatever I can to feel good in the moment, which ultimately is going to become pain in the end. And recovery flips that. It's difficult. It's not easy to have these conversations. It's not easy to address it. But when it happens openly, with humility, with dignity, with vulnerability, it's great.
Yeah.
That nectar, that poison turns into nectar.
So how can we, not as therapists or clinicians or practitioners, but just as people, work to reduce the stigma in our community?
By talking about it. By talking about it. It is the ability to engage people in conversation, to ask, to be curious, and to offer the fact that there is support,
Provide hope.
there is hope, right? There are great resources that are available.
And when it comes to family, being able to talk about it with them, what would you say would be some approaches for them to use as well?
So I like to think about things in terms of context and content. The context is kind of the environment that we hold the conversation, and that is loving, that is compassionate, that is empathetic,
So important.
firm, courageous, right? Those are the qualities of the environment. And then that allows the content to be heard and received much better. And the content, to me, is around, again, being curious, being non-judgmental, being direct, right? And this ability to address a subject that nobody comes with a owner's manual on how to do it, right? So also for people that are being impacted by somebody else's use, being able to get their own professional help and ask.
So those who need to do the supporting need to be supported themselves. Is that what you're saying?
Something about putting on your own oxygen mask before you put it on somebody else.
Yeah, great point.
Yes, that team approach
Yeah.
is really key.
Can this be applied towards our friends too, not just family? If our friends are struggling,
100%.
same approach.
100%. And when it comes to friends, there's a really tight line to cross, which is, I don't want to rat my friends out. I don't want to tell on them. I don't want to get them in trouble, kind of thing. But I would say that if you're generally concerned, beginning that conversation, certainly at home with your parents, is helpful. So you don't have to navigate what to do alone. That is more reason to have conversations with your kids, because it may not just be about them, it may be about their friends. And allowing them a safe space to have these conversations is really helpful.
And what if you are the one struggling? What can you do then?
Yeah, for me, that is a really great question, because more often than not, people that get help from substance use are in a bad way. There has been some type of consequence that has happened that has them having to face this. But before they got there, in many cases, that person contemplated getting help, but they were afraid. They didn't know what to do. And I think the most important thing is to be able to recognize that there is hope, there is a way through this, that honesty, that courageousness is really part of what's needed. And, getting with your parents to ask for help. If you're seeing a therapist, really being honest in therapy with that therapist, because therapists can only do as much as they really know what the truth is. So it's having that ability to have a challenging conversation and ask for help.
But first, I think you need to be honest with yourself.
Correct.
What's going on, what the problem is.
I think the first step is that, which is surrender. And from surrender, I can ask for help. Ask for help. If I'm holding on tight, I'm defending, I'm deflecting, and I'm not open.
And that takes a tremendous amount of courage. So I see what you were talking about how courage comes into play.
Totally.
It must be so hard, but so worth it in the long term, in terms of long-term consequences, like you were saying. Yeah.
I mean, it's having like a sustainable, happy life, and being able to live, a most fulfilling life too. And it can be hard to really, see that path and feel like that there really are those next steps if we're keeping it to ourselves and not seeking support.
And there is a network and a group and a community of young recovering people that have overcome so much and are living fulfilling lives and have gone on to create some great results in their life. And I think that there is there's a spiritual element to this as well. And that spiritual element is that, I'm of the belief that the punchline to a young person's life is not have a real difficult situation and their life is over.
Mm-hmm.
That there is the ability to be able to come back from that, to learn from that, to have redemption from that, to be able to utilize. I heard one time somebody say that my mess became my message.
Oh, wow.
And to utilize what is able to be learned in this process of pain.
Yeah, we're humans. We're such resilient creatures.
That's the word. The ability to be able to understand that we are resilient and to lean into that allows for the particular place that somebody might be in right now to see that it's able to be changed.
So if I'm kind of questioning myself and my substance use, what are some questions I can ask myself to kind of raise that level of awareness to see that maybe there's something going on here that I need to address?
So one thing is, if I'm honest with myself, how much am I thinking about either using, getting a substance, or actually under the influence of that substance? Looking at that as a question. Another great question is being able to say, have I said to myself that I'm not going to do it, and then I end up doing it anyways?
It's like a loss of control almost.
Another great question is, have I made a decision to use at times that it's not appropriate? Right? So showing up for class, going to a family event,
going to work,
not handling responsibilities. Another thing is to look at relationships. Am I in a situation all of a sudden where I have conflict in relationships, and the common theme in that conflict is me, that I have one with her and him and her and him, and I'm the common denominator. That's another place. That's another place to look. So those are a few areas.
That's really helpful to hear. Thank you. So if I have a problem, what does that mean for me? What do I do?
Ask for help. Ask for help. There's no guide that says this is exactly how you do it. It's being able to recognize that I don't have to stay in this place. There is a better way. I can't do it alone. I can get help.
And if we don't know, to ask, that you can talk to someone.
Yeah, that's the recurring theme I'm seeing from this conversation, is that we need to name it to tame it.
That's
to address it.
Yep.
Exactly.
Talk about it. Kind of like what we're doing here today. What does seeking help for a substance use situation entail? What does therapy look like? What does the process kind of entail? So
typically the first part of the process is really getting assessed. And there's an assessment for a particular level of care. And there are different levels of care available. Right? You guys at Therapyology provide an outpatient level of care, which is somebody being in therapy and being seen once a week or numerous amounts of times per week. There is also a level of care called intensive outpatient. Intensive outpatient is where somebody is part of a group. They meet 3 times a week. It's usually 3 hours per group. And it's a combination of education and group therapy. And then from there, there's higher levels of care that are more in the line of residential care, where somebody's particular use has gotten to a spot where it's recommended that they actually go away to treatment into a center to be able to get therapy, to be able to do group, to be able to be out of the environment that they were in before, to begin to heal.
So there's options for people.
100%.
And would you say that they're like affordable options as well?
So there are options that are taken by that insurance takes and reimburses, and there's options that is a combination that the insurance will pay a certain amount and a certain amount is out of pocket. And then there are those providers that don't accept insurance, is expensive
Mhm.
and is completely private pay and out of pocket.
Mhm.
But there is help available,
Mhm.
and there's even help available for people that don't have resources. There are places that provide financial aid and help, and willingness is number one. With willingness, there is the ability to get some type of help.
There are cost-effective community support groups like you mentioned, communities,
Yep.
social media groups for support, stuff like that too, I would assume.
Absolutely.
So what's your personal therapeutic approach when working with someone with a substance use situation that they're struggling with?
So I myself am not a therapist. I'm somebody that has been long-term recovery, and my company works with people that are and families that are navigating some of the challenges of mental health and substance use. My personal approach is very similar to a lot of conversation that we had. It is really about providing a space for people to be heard in a loving, open, compassionate way.
So important.
Yeah, it's being curious, and really wanting to find out what's going on. And I think the other part of it is this 50-50 approach. 50% of a relationship with somebody who's looking for help is about them, and 50% is about what I bring. So my own self-care and my own practices of recovery are really important because it helps being able to work with somebody be more authentic than do as I say, not as I do.
Yeah, absolutely. You have any final thoughts, anybody, on the topic?
So something I was wondering too, as far as working with, that team dynamic, right? Like with the client, but the family and the community. What does kind of those different approaches look like when it comes to working with, that client one-on-one, the family, the community?
So I think if I'm thinking about it through the lens of a client that is seeing a therapist, it's this ability to be able to have a therapist that recognizes that family involvement is really, really important. And talking about this team approach, being able to have the ability to speak with the parents and have parents understand that they have their own journey to be able to help their own self-care, because if they're dealing with somebody in the family who's struggling like this, it impacts everybody. And if our own emotional tanks and self-care tanks are depleted, it's really hard to be there for somebody else when we can't be there for ourselves. So being able to help families on their own journey to get their own therapy, to do their own self-care and sleep and nutrition and exercise and mindfulness, those types of things that help prepare us to best support our family member.
So important.
Those are great points too, as far as really with like the team, right? Everyone's navigating things, everyone's working on, their own path and how to support each other.
Yeah.
And so it's not just centered on, the client themselves too. It's being able to support them, but also, everyone is navigating.
Totally. It's a we approach.
Yes.
And this we approach, if you think about it in terms of like GPS, so the person of concern, the loved one that's struggling with substance use, let's say, they have a GPS. They're here right now, and where they want to get to is to get sober, to be healthy, to be able to really participate in their life in a positive way. And there's some directions along the way for them to go. But there's also the same thing for each family member, right? Each family member, if the family is in recovery, they have an existing location and a current location that they want to go to. And when a family can kind of crystallize where they're going, it really is valuable. And it's something to be talked about and brought to light, because then when we know where we're at and where we're going, we got a better chance of getting there. I mean, if we use the GPS metaphor, it's really hard for it to be effective when you put in an address, but you don't know where you currently are at. Or if you know where you're currently at and you want to get somewhere, but you don't know where that is.
You need both pieces of the puzzle.
That is correct. And we got multiple people that are traveling this road. So being able to get clear about that is that team approach.
So I guess I think our biggest takeaway here today is that this is something that just needs to be talked about in whatever form or setting or context works for people. Is that what you think?
That and really support and the we approach the team, and just really emphasizing that, like creating that space to be able to talk about it.
Yeah. For me, this takeaway of that substance use disorder is not a weakness or a moral failing. It is not a choice. That once somebody walks past that line, it needs help, and it's help that is loving, that is caring, compassionate, dignified.
With dignity, yeah. So thank you everyone for being here today. If you or anyone you know at home is struggling or has challenges with their substance use, please reach out for help. Thank you both.